Well, as COVID numbers spike nationwide, doctors say they're becoming increasingly concerned about the number of pediatric cases. Many parents also are worried and trying to figure out how to protect their kids who can't yet get vaccinated. Well, tonight, LEX 18's Evelyn Schultz takes an in-depth look at kids and COVID-19.
As a growing number of American children test positive for COVID-19, parents like Lori Armstrong are increasingly concerned and cautious. The mom of 3 says her youngest daughter is just 4 years old and doesn't yet qualify for a vaccine.
Well, as far as we know, my 4-year-old is healthy. At this point, I don't feel like that's necessarily a guarantee that this would be easy on her.
As cases spike, pediatricians are also warning parents to play it safe when it comes to their kids and the virus. That means masking up and vaccinating children who qualify.
I know we have chosen to be much more cautious than many families, and we have put some things on hold and deferred some things. And I know that not everyone can do that or is willing to do that.
We know kids are less likely to get seriously sick or go to the hospital when they get COVID-19, but doctors say that doesn't mean they're immune from the virus.
Like, kids do get sick, but we have heard they do pretty well. And most of the kids that we have been seeing that have gotten that are positive has been more of just the congested, a little bit of a cold. Yes, as a parent, it's nerve-wracking for the kid, but also because then they expose others.
At Pediatric and Adolescent Associates, Dr. Katrina Hood says they're witnessing the effects of an Omicron surge. She tells LEX 18 they've tested 400 kids in the last week. 30 of them tested positive. Nationwide, nearly 200,000 American kids tested positive for COVID last week. That's a 50% increase since the beginning of December. Despite this recent surge, Armstrong says she's decided to send her youngest to in-person preschool starting next month.
We're going to let her go because developmentally she needs it. But at the same time, we know that we're introducing a level of risk because even with masks, nothing is perfect.
A wave of pediatric infections forcing parents to make tough decisions. In Lexington, Evelyn Schultz, LEX 18 News.